So this video is about the atherosclerosis. Now atherosclerosis is a category in arteriosclerosis. So what is arteriosclerosis means? The name indicates that sclerosis means thickening and hardening of the arterial wall. So it has different categories like senile arteriosclerosis, which occurs due to aging. Whenever individual ages, it causes senile arteriosclerosis in almost every individual, and also it causes hypertensive arteriosclerosis whenever the blood pressure is high. And Monckeberg's medial sclerosis, in which there is calcification in the medial wall, that is tunica media muscular layer is thickened. In X-ray we can see as dense calcified wall in the media. And the main category here today we are going to discuss is atherosclerosis, which name indicates the athero means fibrofatty plaques, and by the definition it is the thickening and hardening of the large and medium muscular arteries. So there is in the intimal layer we have fibrofatty plaques formation that is called as atheromas. So it causes ischemia in the long term atheromas, and due to ischemia in the brain it can cause in the heart vessels like coronary vessels, whenever they get ischemic, there is angina and also myocardial infarction, heart attacks can occur. Whenever when there is infarct in the brain, it can cause strokes, and whenever infarct in peripheral arteries, it can cause peripheral arterial disease. Okay, next we'll see about. So coming to the etiology, we have three groups of problems which can lead to atherosclerosis. So the first group is the major risk factors that are modifiable by our lifestyle and therapy. So which means by changing our lifestyle or taking some medicines, we can prevent atherosclerosis formation. The next one is which are non-modifiable risk factors which we can't change, like age, gender, we can't change those, and emerging risk factors or other risk factors. So the first etiology is the major risk factors modifiable by lifestyle. It is dyslipidemias, in which there is increased LDL, decreased HDL and cholesterol. We know LDL transports the triglycerides or cholesterol from the peripheral organs, peripheral tissue to the liver. So HDL does that. So whenever HDL is low, there is increased risk of high cholesterol levels in the blood. So what happens is whenever there is increased LDL, there is decreased hepatic uptake of the triglycerides and cholesterol, so it increases the plasma concentration of cholesterol. Next we have hypertension. Cholesterol, whenever it is high level, it can form the atheromas. In pathogenesis we'll see later. And hypertension, which will injure the vessel wall, so it causes inflammatory reactions and it causes atheromas finally. In diabetes mellitus, we see there is endothelial dysfunction and also increased LDL and HDL. In smoking, there is increased carbon monoxide release, so it can lead to hypoxia in the tissue, and it causes arterial wall damage, which can lead to atherosclerosis. Next, lifestyle risk factors which are atherogenic diet, like which have trans fat and more of fat containing foods, and obesity and physical inactivity. And next we have constitutional non-modifiable risk factors which can be modified, like age. So with the increase in age, there is increased proportion of getting atheromas. And next, gender, women are mainly safe or less prone to get atherosclerosis because of the estrogen. Mainly premenopausal woman has less chance of getting atherosclerosis because estrogen is anti-atherogenic, whereas in men are more prone than women. And genetic factors in lipidemias, dyslipidemias, we have many dyslipidemias, you can see it later, which can lead to atherosclerosis. And next we have racial factors, like whites have more chances of getting atherosclerosis than blacks. And emerging risk factors like environmental influences and estrogen hormone, which is mainly helpful to prevent atherosclerosis. And stressful behavior and increased homocysteine levels and increased alcohol consumption. This is high level of alcohol consumption. Whenever you take a moderate amount of alcohol, it is beneficial to prevent atherosclerosis, as it increases the HDL levels, so it is protective in nature for preventing atherosclerosis. Next we'll see about the pathogenesis. So the pathogenesis of atherosclerosis follows different theories, but the most accepted theory is response to injury theory. So what happens in this theory is whenever there is dyslipidemia or any mechanical injury or carbon monoxide levels are high or hypertension is there and toxins are present, etc. These are the etiological causes which can cause damage to the epithelial injury of the blood vessels at the point of bifurcations. Like you can see, whenever the pressure is high, it can cause injury at the bifurcations. So the subendothelial connective tissue get exposed. So what happens is there is increased adherence and aggregation of the platelets and inflammatory cells. So what happens is these inflammatory cells and platelets will release interleukin 1 and a tumor necrotic factor alpha. So this will cause proliferation of the smooth muscle and also synthesis of matrix proteins. These matrix proteins are like collagen, elastic fibers, and proteoglycans. And when you see, the other thing that the platelet inflammatory cell will release is platelet derived growth factor. These are released from platelets which cause migration of the smooth muscle from the media to intima. So normally we can see this is the whenever there is endothelial injury, there is inflammatory reaction in which the smooth muscle cells will migrate from the medial layer to the superficial, that is intimal layer. Okay, next next we have release of which causes the migration of smooth muscle from media to intima. Next we have endothelial injury can also lead to inflammation. So due to inflammation, there is more monocytes which are coming into the intimal layer. So what happens is these monocytes will change into macrophages, and it will take up the oxidized LDL present in the blood. There is plasma LDL. So whenever it enters intima, it gets oxidized into oxidized LDL, which is taken up by the monocytes or macrophages, which will become lipid-laden foam cells. These macrophages which have oxidized LDL are called lipid-laden foam cells, which undergo death. So this death or apoptosis of these cells will cause lipid core plaques formation. Okay, this is one of the pathogenic reason. And to simplify this process, first there is endothelial injury, so there is inflammatory response. So endothelial cells will show cell adhesion molecules on the surface, which will help in monocytes to migrate into the intima and become macrophages. So these macrophages have scavenger receptors. There is a specific receptor called a scavenger receptor for LDL, so which will intake the LDL and become foam cells, and whenever these get apoptosis, then there is plaque formation which have lipid core. So this is about the pathogenesis of atherosclerosis. Next we will see about the morphology. So in morphology we can see intimal thickening and fatty streaks and luminal narrowing. You can see here there is a luminal narrowing and intimal thickening, and also fatty streaks in the central area, and the atheromatous plaque formation involves, in grossly we can see yellow white raised surface. So this raised surface is yellow white in color and grossly. So on the cut surface there is a luminal fibrous cap formation. This is the fibrous cap, and core have soft yellow lipid containing material. So this is the core which have fat containing core. And next microscopically the luminal part has a fibrous cap covered by endothelium and have smooth muscle, collagen and proteoglycans. So when you see here, this is the luminal part has a fibrous cap which is covered by the endothelium of the lumen, and blood vessel, and have smooth muscle and collagen, proteoglycan, and also some of the macrophages that are invading. And in the cellular area that is under the cap, and the cap there is it is composed of macrophages and foam cells, lymphocytes. So you can see the foam cells, lymphocytes and other macrophages which are present in the just below the cap. And next in the deep cellular area there is extracellular lipid, cholesterol cleft, fibrin and necrotic debris and foam cells. You can see there are cholesterol clefts necrosis in the core and foam cells, and the lipid, extracellular lipid is also present. In advanced stages we can see calcification, ulceration, thrombosis, hemorrhage. So you can see there is finally formation of calcification in the complicated plaque. Okay, this is about the morphology.
iPad.